Hello, everyone. It's Thursday, July the 2nd. We won't have a briefing tomorrow. That's why we had this briefing today. And I'll conclude with this, we want to wish everybody a happy 4th of July weekend is coming up, and we want you to be safe in your travels and all the stuff you do, but especially, and I'll dwell on this in just a few minutes, but especially really take time to be appreciative for what this day is in our nation and Independence Day. It's incredible. And but at the same time, we got to ask you to be really careful, over this holiday weekend, because there'll be a lot of visitors here and a lot of people that'll be relatively close together. So be really careful. Really happy again today that we don't have an additional death in the state of West Virginia. We still have lost 93 too many great West Virginians, and we don't want to forget those people. We don't want them to become a statistic and everything. Just remember them in your prayers, your thoughts, always. This is week 10 of the West Virginia Strong, the comeback reopening plan. The guidances you've already got, and they're up on our website. And so I want to talk with you, as I have, West Virginia over and over. We are not facing a problem today. We are doing an incredible amount of testing. And the more testing you do, the likelihood, the more positives you'll get. That's a good thing. Now, it's good from the standpoint that it gives us more and more knowledge. More knowledge makes us better. Now, with that being said, just look what's happening all around us, all around in this country. We're watching it, and we're watching it as closely as we possibly can. Now, we know that there's a tidal wave that's out there. My daughter just gave Kathy and I and Joe and Charlie Long a wonderful granddaughter to go with a grandson that we have. Now, in all of that, she's in one of the greatest, medical places in this country. The heart of all the information, just about, or a lot of the information that comes out on the COVID situation coming from Johns Hopkins. This morning, she was telling me of a discussion that she had with one of the chairmen. Now, this is just, not that doctors are just doctors. The doctors are phenomenal, but this was a doctor that just happens to be one of the chairmen. And here's what he said. He said, without any question in his mind, there's going to be another gigantic spike in the COVID situation. As far as the herd immunity stuff that's out there, he said that many people that have had the COVID-19 disease have not developed immunities. Now, whether that's half the people are developing immunities or half aren't, it's a very considerable number have it and can get it again. Now, I'm not a doctor, and so I'm speaking way out of my league. And I just assume that if you haven't developed the immunities, then you can get it again. I could be wrong about that. I don't think. But the bottom line to this whole thing is, if we watch what's going on in South Carolina, what's going on in Texas, what's going on in Florida, this thing is exploding at a time when really and truly the sun is out, and we know the sun is our big time friend. And so as we move forward, if we don't watch, we're going to have something to really contend with here. Now, with all that being said, you have given me the honor to look after you. This is not easy to do right here. But I want you to know that the thing that combats this disease and makes it powerless is when we restrict this disease from passing from one to another. Now, how do we do that, West Virginia? How do we do it? We stay home, and we did that. And we were pretty successful doing that. We stay at social distancing, and we were pretty good at that. We have not seen this relapse come back at us. Now, if you believe that it's coming and the winds are going to, and it doesn't flow in the winds, but just as a concept that it's coming, how are you going to stop it, West Virginia? How are you going to stop it without us going back to our homes and shutting everything in the world down and everything else? And God forbid we may end up having to do that. But the way you stop this is mask. Wearing your mask. I want everyone to know that I am very, very seriously considering that at the beginning of next week, we may very well have to go to mandatory mask in buildings, other than your homes. You go out and you go into a building, you need to probably wear your mask. We tell you you need to, but we may have to go to mandatory mask, and we're watching it, and we're watching it with all in us. I'll give you more of an update on that in the beginning of next week. We don't have enough data. I wanted to give you notice of something that could very well be coming. If that is such a horrible, horrible inconvenience in your life, please just think of what it will do to save us and keep us to be able to do all the things that we're doing today in West Virginia. For all practical purposes, we're surviving in a good way economically. Absolutely, without any question, our numbers are phenomenal. But we still have 93 deaths, and we're still the oldest, and we're still the sickest in lots of ways in West Virginia, and positioned within a rock's throw of all those people that are having all kinds of issues. So West Virginia, prepare yourself for just the fact that you may have to, maybe not ask, you may have to wear a mask in buildings to where you cannot social distance. Now, what we're saying is if you go to work and, like I'm here and we're able to social distance, well, there's no need in the workplace to have to wear the mask. But West Virginia, we do not want to end up being Florida. We do not want to end up being Arizona or Texas, to where they can't stop this now. We do want to listen to docs at Johns Hopkins or the great docs that we have and the people that are working as our experts. We've got to be prepared to take care of ourselves and all of our citizens. We will revisit this next week, Monday. But I want to give you notice that right now, I am terribly concerned about what's coming, and this situation, we're not going to be able to stop it, and it is going to come to West Virginia. And as it comes, the way we shut it down is we don't let it transmit from one to another. I, of all people, get it. I get it. I know the inconvenience. I know the invasion of our privacy and everything else. I get every bit of that, West Virginia, but it is my job to protect you. It is my job, no matter how much we like or don't like, to protect you. And so at the end of the day, we may very well have to go to mandatory mask in situations to where we cannot social distance or we're in buildings, not just outside, If you leave your house, there's no need for a mask in West Virginia. There's no need to be wearing masks just outside and everything. And so, but at the same time, the masks do prevent this thing, and the mathematics of the mask are unbelievable in the mask favor. So anyway, we're going to continue to bring data in, and we're going to continue to work it, and continue to look at our numbers. And it may very well be that I can report to you next week that we're still in good shape. And believe me, be the last thing on earth that I'm going to do is pull the trigger until I know that it's the right thing to do. But my gut tells me that if we don't watch out in West Virginia, we're going to get in real trouble. I'm going to go through these other things pretty quickly. Think about this. We're still working these active cases, and I think now the active cases are 585 or 565 or something, and we're still working them. And I think we're still working 127 cases that may very well come off of that. And then we drop down into 400s. But think about this just a second. 115 of our active cases, if in fact this number drops into the 400s, 115 of them are people that have been to Myrtle Beach. You've got to watch that. You've got to watch that. And on an update on our jails, now we have still one active case in one prison. It's in Huttonsville. Great work, everybody there. As far as the free testing, today we're in Harrison County from 2 to 7 at the Robert C. Byrd High School. And next week we'll be in Mercer County, Marshall, Mon County, Preston County, and Wayne counties, and that'll be the 10th and the 11th next week. Again, all the testing's free. There's it's harmless. It takes just a second. Come on, get on board and everything and get tested. The more we test, the more we'll know. As far as our grants and everything, we're still continuing to pump money out to the cities and counties. The more applications we have, the more we can get out the door and everything. And know that once you apply, and this is something that I haven't said for a little while, but once you apply, you can reapply and everything. So absolutely just put down what you think you can qualify for here, and we'll just go it piece by piece and keep pumping the money out to our cities and our counties. Our feeding program should be up over there and everything, and 690 sites, and like I said, well over, heading towards 10,000 people that have picked up food and that we're working with. If you have an issue and everything, call 211 and we'll help you in every way. Last thing I want to talk about just a second there is the census, and we're at, I reported we're at 53%. The national average is at 61. We got to catch up. We got to catch up, West Virginia. So get counted. Now, I want to congratulate here. 80 graduates, 80 cadets graduated, and I think General Hoyer touched on this yesterday, but 80 cadets graduated from the National Guard's Mountaineer Challenge Academy, and how proud of them all of us are. Now think about what they've done. Just like in our high school seniors and everything, they had to deal with working with their training virtually. They absolutely had all kinds of challenges from the standpoint of this pandemic. It was just, it's a testimony to the great leadership and everything that's coming from our National Guard. And we want to absolutely wish all these kids, no matter whether their future's in the military or the classroom or in our workforce, these kids surely had some level of some issues. And absolutely the Guard has put these kids on a good pathway to life and everything. And these kids, their work and their grit has absolutely done this for them. I watch and I try to learn from everybody coming or going. Mark Cuban the other day said to a lady, "What's your grind?" And she said, "Well, I don't know what you mean." Well, it was in Shark Tank, and he immediately turned around and said, "I'm out." And then he said to her, he said, what I mean by grind is just this, is what's your determination? What's your passion about what you're doing in life? Well, these kids to get through this program as rigorous as it is, you know, you need to be really congratulated, especially at this tough time right here. Because, you know, it would have been easy to quit. It would have been easy to quit when everything, you know, went haywire with this pandemic, but you didn't. You didn't. I congratulate you in every way. Way to go. The last thing is just this. Again, it's the 4th of July, Independence Day. Incredible, incredible, incredible holiday. Absolutely unbelievable. You got to be careful, West Virginia. There's winds blowing out there in our nation, in this world, that are bad winds. There's seas that are so rough that we won't be able to maintain. Absolutely, you've got to be careful, West Virginia. And stay right with me and stay together. Like I was talking to you just a second ago about the mask. It may be an inconvenience. You may not like it, and everything else. Well, there's lots of things in life that I may not like too. But for the sake of the good, I do it. So please, West Virginia, just stay with me. Stay with me. We're going to absolutely continue to be that beacon. And at the end of the day, we're going to be the miracle. You already are. Stay with me. We're going to get there. Thank you so much.
Thank you, Governor. Let's now go to Major General Hoyer with the West Virginia National Guard.
Good afternoon. Over this 4th of July weekend, we will have a slower operational rate for our 437 Guard personnel on duty to give them an opportunity to rest. But at the governor's direction, we have personnel on standby for a variety of different missions to support things should we need to be quickly activated for events over the weekend. We'll continue to monitor the metrics. Governor talked yesterday about the significant effort to monitor with the Hospital Association, hospital metrics on hospital bed use, ICU rates, as well as ventilator rates. We continue to monitor those to make sure we are on track as a state with those. And I'd just like to close and highlight a couple of historic points and some things going on today. July 4th, 1775, 98 militiamen who make up the lineage of what is now the West Virginia National Guard were on their march to Cambridge to meet General Washington to help form the Continental Army. Over this 4th of July weekend, we will have men and women from the West Virginia National Guard both returning from deployment as well as leaving for deployment. So since the formation of this nation, the people of this region and what is now West Virginia have been serving this nation. And as the governor has asked, and what I would ask on behalf of those men and women, is we continue to double down on the things that we need to do to mitigate the spread of this virus so that West Virginia continues to lead the nation. Thank you.
Thank you, General. Next, we'll go to Secretary Bill Crouch with the West Virginia DHHR.
Good afternoon, everyone. Want to just mention quickly, actually respond to Paul Mullen's question of yesterday. I didn't have that data in front of me. We collect that, but we don't routinely keep that with us. But it is the question of the active cases, how many are asymptomatic versus how many are symptomatic. And that number can change. As I spoke yesterday, once individuals are tested positive, the local health department follows these individuals daily in terms of symptoms, whether or not they have symptoms, whether or not their temperature is increasing, if they have a fever. So any individual who's tested positive over the course of 14 days can actually develop symptoms. So right now, the question was specifically about Preston County. Only one individual is asymptomatic of the 14 individuals shown as active cases in Preston County. So again, I hope that answers the question. Appreciate it. Everyone, please have a happy 4th of July weekend.
Thank you, Secretary. Dr. Clay Marsh, our coronavirus czar, has a previously scheduled engagement today, but he will be joining us again on Monday. Once again, we're holding today's briefing with media members joining us virtually to practice good social distancing. Our first questioner today is Taylor Stuck from the Herald Dispatch.
Hi everyone, it's Taylor with the Herald Dispatch. This is probably a question for Secretary Crouch. I was wondering if you are also monitoring hospital staffing levels. Cabell Huntington Hospital had some people or one person test positive, so now their orthopedic and trauma department had to move things around so people could be quarantined. Is that something else that you're monitoring as we look at hospitals?
Secretary Crouch?
Yes, Taylor. Yes, thank you, Governor. Yes, Taylor, we do follow staffing as many other metrics with regard to the healthcare system. We try to stay in touch with the hospitals in the state in terms of their needs and what's being done. We also, as you probably know on the dashboard, have a number of individuals hospitalized with COVID, number of individuals in intensive care, and a number on ventilators. So those are important metrics as well. But many times I'm in touch personally with the CEOs of our hospitals in terms of their situation, their staffing needs. So it's a concern, and we're looking again at a potential surge in West Virginia. We've talked about that before. We weathered the first surge well. We really didn't have a surge. The governor was just absolutely terrific in getting the message out for people to fight this disease with regard to masks and with regard to staying at home and with regard to sanitization, and that worked. So we're concerned going forward here. As the governor said, we've got to stick with our plan and do what needs to be done here to stay safe. So, but the hospital industry, we're constantly in touch with them in terms of their needs, and actually just again stood up Fairmont in Fairmont Hospital, and we've been in contact last week with St. Francis Hospital in terms of how long it would take to staff St. Francis should we need that facility. So thank you for the question, David.
All right, thank you, Taylor. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. My question is, the way I understand it, the state is reporting its highest number of cases since mid to late May. Why not go ahead and make that decision to mandate masks today instead of waiting until Monday?
Well, was it Dave? Is that correct? Dave, we're still gathering more and more information in, Dave, but I think really and truly 2 or 3 different things. I think one is we need to give the people a little notice from the standpoint of being prepared. And the other thing is we're still gathering in information and everything, and so we'll make the decision on Monday. And the last thing with that is just this: is if you look, and we won't have this slide, but if you look at the amount of tests that we did, and to yesterday, our number came back at 1.81. Now, it's still a fabulous number, and the reason we had a significant bump up in positives is because we did a boatload of tests and everything. And so if you just look at the number of tests, let me make it really, really simple. If you test one person and they come back negative, well, you don't have any positives. But if you test 10,000, you're going to have a number like 300 positives, and we haven't had 300 positives in a day because we haven't tested 10,000 in a day. But the more you test, the more we're going to have in positive. But my feelings are just this: the more you test, the more knowledge you have. I am a sole believer in the more tests, the better. And so with all that being said, I don't think that we have any number from yesterday that is alarming at all, because we had an incredible amount of tests. But trust me, by Monday we'll know a whole lot more, and we're still gathering data and everything. But I can tell people just this, and that is, if you don't have masks now, start either maneuvering yourself to be able to have a homemade mask, or start maneuvering yourself to be able to carry a mask with you as you go outside, as you're going to enter buildings and so on like that, because it is just smart money, and it's the thing you need to do. And so just get yourself prepared, because if we go to a mandatory mask situation, in our buildings and stuff, not to just go outside, but just in our buildings where we can't social distance, be prepared to be able to do so soon.
All right, thank you, Dave. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Thanks for the time today. I'm going to throw the question to you that you brought up a couple of weeks ago about masks, and you were saying that, well, if you do mandate it, how do you enforce it? So if you do make that decision on Monday, how do you enforce making West Virginians wear masks?
Well, Dave, it's really tough. And we're sure not going to start hauling people off to jail that don't have a mask on and everything. But we're going to ask everyone, with all in us, we're going to ask everyone to comply if we have to go that way. We're going to ask our businesses to help encourage and everything, and then be able to apply. But absolutely, the last thing on earth we're going to do is haul somebody off to jail. Now, in all of that, we hope that West Virginians will stay together and be considerate of others and everything and comply. Now, but remember just this, and I think Dr. Marsh, if he were here today, he's traveling in Indiana, but if he were here today, he'd tell you just this. If we get an 80% response, and we want a 99.999 if we have to go that way. But if we get an 80% response, it literally starts shutting this disease down right here. So, the $64 question, unless we want at some point in time, if this thing whips back on us, and the odds are, if you're just fair and you're watching, the odds are we're going to get some level of something where it whips back on us. Now, if we don't want to get in a situation to where we have to start shutting things down and closing things and going back to a stay-at-home orders and all kinds of stuff like that, we've done a great job to progress to where we have. This is some level of inconvenience if we have to do that. I get it, but I'm not going to apologize for that, because really and truly, all I'm trying to do is help you. And if we have to do that, that's what we're going to do.
All right, thank you, Paul. Next, we'll go to Anthony Isguire with the AP.
Governor, can you walk us through your decision-making process on the masks, because it has so far been unclear? Are you making this decision based on what someone at Johns Hopkins told you?
No, Anthony. Anthony, I look forward to the day. Now, you think about this over the 4th of July. There's got to be a day when you're going to find something positive about what we've done. We've got 93 people that have died in West Virginia, which is 93 too many, but it's phenomenal. We've absolutely worked out all the economics beyond belief, but you still try to pick some little something to dwell on that's a negative. But the bottom line of this whole thing is I've had multiple conversations with all the medical experts that are around me. I am watching everything from the standpoint of all the consults that I've had with the federal government, all the consults that I've had with the other states. Absolutely, I'm watching it. I'm watching everything. And at some point in time, when the information just assimilates itself in a big enough way that you really need to act and everything before this situation grabs a hold of us. See, I don't want to be the person that is trying to rescue us once the flood has already got us in the middle of the river. I want to make sure that we get on high ground before the flood ever comes. And so we'll make the decision, but it is an accumulation of lots and lots and lots of stuff. And the other thing, let me add this too, Anthony, it's just this. We're watching our beds. We're watching our people that are on vents. We're watching the people that are in the ICUs and all that. Our numbers are good. From that standpoint, if we were just watching that, we'd say, have a happy 4th of July and everybody going down the road. But you've got to watch. I think the number in Texas today was they had 6,000 some odd positives in a day. In the United States of America, I think today, and I want to tell you this because I think this is really important. I think it was the largest day in our nation's history. We had 52,000 positives yesterday in the United States. So, whether it be docs at Johns Hopkins, whether it be our medical experts here, whether it be whatever's going on, whether it be all the consults with all the people. If you're not watching this, you're asleep at the switch. We're watching it. We're watching our numbers, and absolutely we're going to have to make a decision, and we'll have to make the very best decision we can possibly make. And we make that decision and everything, we move forward to try to protect our people. We don't do it apologetically.
All right, thank you. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, Governor. Hi, panel. This is Kenny Bass with Channel 8 and Fox 11 in Charleston. Governor, what do you tell people, including Melody Potter, who's the chair of the West Virginia Republican Executive Committee, who posted yesterday on social media that wearing a mask is a choice and she respects the rights of others to wear them, but you should respect her right not to. And then she quoted Patrick Henry's famous quote of "give me liberty or give me death." And then she posted West Virginia code where it's actually illegal to wear masks, although there is the caveat for emergencies. So what would you tell the chair of your own party who's posting that basically she isn't wearing a mask and isn't going to wear a mask? How do you get this off the political spectrum into the medical and health spectrum?
Well, first and foremost, Kenny, you know, and Melanie knows this, I think the world of her, I love her to death. I think she does a great job and everything. I would say to Melanie, if Melanie is absolutely adamant about not wearing a mask and everything, I would ask her if we go to a mandatory masking and everything to go in our buildings and everything. If we cannot social distance, I would ask Melanie not to go in the buildings. But at the same time, I respect people's views and everything. But we're in a situation here to where nobody's got the playbook. Nobody's got it. I can't tell you unequivocally that Jim Justice is right in what he's doing here. But I can tell you unequivocally, my heart is right in trying to protect our people. I'm not a politician. I don't want to be a politician. I don't want any part of this to be political. But if you don't watch and you don't see what's going on, then I don't think you're watching. If you're not seeing 52,000 positives in this country, and you're not seeing the possibility that this could come here, and if all we have to do, if we're going to go into a building and shop for 30 minutes, all we've got to do is wear a mask for 30 minutes while we're shopping in a building? I mean, is that too much for us to ask? Well, it's not. It's just not. If that is the very key that protects us. Now, we're going to gather a whole bunch more information, and we're going to make the best decision we can make, but I'm going to make the decision that is the best decision that Jim Justice can make, not the decision that's the best political decision, not the decision that is a party decision. It is going to be my decision as to what I think is the very best for all West Virginians.
All right, thank you, Kenny. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hi, Governor. Did the folks in revenue happen to find the missing $1.37 million? And when it's determined who was at fault, will there be any disciplinary action?
Okay, I'm going to let our Secretary Hardy come up, and he'll give you a report on it. And he surely knows a whole lot more about this part than I know in regard to this, because I haven't gotten a briefing on that this morning.
Sure. Phil, yesterday morning, about 8 o'clock in the morning, we were surprised that when we were expecting a $500,000 surplus in an account, and in fact it was showing a deficit of approximately $800,000. So there was $1.3 million that we could not understand what had happened from the previous evening when we had reviewed the account and got ready to close the books. We asked our folks at tax to look at the revenue side of that account, because I think about $9.6 million had come into the account on either the 29th or the 30th. So we went back and we audited that to make sure that we had not made a mistake or there'd been a wire issue on that side through the electronic fund transfer. That checked out. We then checked our income tax refund base to make sure that we had not inadvertently misaccounted for some income tax refunds that had gone out on the 30th, and that checked out as well. So we then identified that there was a problem on the expenditure side of the account. When we looked into that, probably mid-afternoon, right after the press conference yesterday, we determined that we had found the problem, and here's what it amounted to. $3.8 million of income tax income came into that account on the 30th, and the person that was reviewing the account accurately understood that that was a $3.8 million uptick in revenue on the income tax side. That would not be unusual. What got missed by not quite understanding the fact that we were having a payday today, July 2nd, was of the $3.8 million, it turned out about $1.3 million of it was income tax withholding that had come from our employees. So as part of the payroll process, and that $1.3 million roughly was moved out of the account over to fiscal year 21 revenue. And it is very unusual to have a pay cycle straddle the close of a fiscal year, and that's exactly what happened, and we learned from it. It wasn't a problem with the OASIS system. It wasn't a problem with the accounting. It was a misunderstanding that the $3.8 million was all revenue. It turned out it was $3.8 million of income tax of all sorts, and $1.3 million of it turned out to be employee income tax holding from our state employees. So that got moved because we were crossing over to fiscal year 21. That got moved into the account for fiscal year 21.
And Jordan, let me come back and finish that up, okay? Phil, I want to just tell you just this, that I have worked not only with our revenue people, with our medical experts. I've worked with people day in, day out on every one of these issues. I hate like crazy for us to be inaccurate on anything at any time, but as I've said many times, we're going to make mistakes. This is such a minuscule mistake, it is unbelievable. But I want to just tell you just this. I want us to bat 1,000 if we can. Now, we're not going to do that all the time, but I can tell you this. I have been with these revenue people day in, day out, and I have seen them do terrific work. And I could not possibly be any more proud of them than I am. I hate like crazy that we've made a mistake and everything that got cleaned up immediately and everything, and it's really not much of anything other than a nothing burger. But with all that being said, I am really, really proud of what they've done, and they've done such good work and everything. There surely doesn't need to be anybody casting stones their way.
I wanted to say, Phil, it was not the auditor's office, and it wasn't the OASIS system. It was on our end, and the system was accurate. We just had a misread of the system. So I wanted to make that perfectly clear to everyone. But it did take 4 or 5 hours, clear into 4 o'clock yesterday afternoon to sort it all out.
All right, thank you, Phil. Next, we'll go to Steve Adams with Ogden Newspapers.
Yeah, Steve Adams with Ogden Newspapers here, and Secretary Hardy, don't go too far away from the microphone there. But sort of related to that question, I know you said you were in conversations with the state auditor's office, obviously after the fact, tried to kind of chase us down, and I know you said it wasn't OASIS's fault, wasn't the state auditor's fault. But I guess my question would be leading up to Monday, well, I guess it'd be Tuesday night, but obviously you had to send certain paperwork over to the auditor's office. But did you all involve the auditor's office over the last week or so? And in this, because it seems like the issue you're talking about probably would have been at least on your radar if you had. So what was the planning in the week leading up to this? Did you involve any other state agencies in that planning? Thank you.
We involved a lot of the process of closing the books, and of course it's a very large budget. It's $4.6 billion of general revenue. The process of closing the books starts long before a week ahead of time. It starts probably around June 15th. We work with whoever we need to work with, whether it be the executive agencies, whether it be other office holders. Now, with the auditor in particular, you asked about the auditor. We were particularly involved with the auditor's office when we were asked to show the auditor's office the backup data that we had prepared for the $57 million drawdown of the CARES Fund, where we had asked to move and wanted to move $57 million from the CARES Relief Fund, the federal relief fund, to the general side. And we did work extensively and provided information to the auditor's office on that particular drawdown. And that number was late coming to the game, because there's one thing about closing the state's books that should always be understood. Until you get to the last couple of days, you really don't have a strong handle on what the numbers are going to be. You've got revenue coming in all the way up till the end, and this was a very unique year in every way it could possibly be unique. And we were trying to squeeze as much as we could out of the general fund, knowing that we'd had a tough year and that we'd had some income interruption because of the pandemic. Now, as far as what's going on today, there's still conversations going back and forth with the auditor's office. Yesterday afternoon, we were asked by the auditor's office, which we prepared and did, to provide 2 letters showing $1 million worth of expenditure reductions in the fiscal year 20 budget, because we do have a month of July where we're allowed to adjust the expenditures. Under state code, we can't change the revenues, but we can adjust the expenditures in the month of July, even though the fiscal year is closed. And we were asked to provide the auditor for his file, and we did, a copy of 2 letters, one to 2 different cabinet heads, showing a $500,000 reduction in expense, which meant that we were going to reduce our expenditures by $1 million to be sure that we had compensated for the initial deficit of $742,000.
And I want to add one other thing too. You know, I think it is, you know, I mean, we surely need to pass kudos where the kudos should be, but you know, the work that JB does over as our state auditor is amazing, and I love it. I love it that how this all, you know, it's just almost like a check and balance situation and everything. And the auditor's office did great work here, and so you know, I think we should pass kudos where the kudos should be.
All right, thank you. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. Governor, yesterday in Harrison County, people showed up to the free testing site, but more folks showed up than they were able to process within the time allowed. It wasn't a matter of supplies, it was a matter of time. And if you look at the free testing schedule, the next free testing isn't until the 10th and the 11th. Have we given any thought to expanding these sites, having them more frequently, having them open longer so people have the opportunity to get tested and contribute to the data? Thank you.
I think General Hoyer can maybe jump in on this and everything, and maybe Secretary Crouch. But I do want to say this too, that, you know, yesterday I told of an idea that Jordan Dameron had, you know, and then today on my briefing stuff, he gave me this thing that says in our free testing, it says today in Harrison County from 2 to 7. Well, that really was yesterday, so that was in error. We're not in Harrison County today and everything, but to follow up on what you're saying, Charles, from the standpoint of if we had people there that didn't get tested, we need to look back at that, and absolutely, General, you take it from there, but absolutely we need to go back to Harrison County and go back immediately and get the rest of all those people tested that wanted to get a test that couldn't get it.
Yeah, to answer the question, a couple of things. Department of Health and Human Resources, supported by the National Guard, continues to work additional capabilities for testing, to including the federally funded healthcare centers, other ways that we're going to expand more access to the public. Related to that particular situation yesterday, there was a glitch in that, and we will double back in that particular area as we continue the testing. The governor's guidance is pretty clear, and we believe as a a group providing advice to him that we have to continue to very aggressively test. So we will make sure that people in that area are taken care of, and we'll continue to improve our processes as we go. Each time we do these, we do after action reviews of the things that we need to do better.
Yeah, this is Bill Crouch. Let me just add, Governor, if I could, I tell you, General Hoyer and his men are the best partners you could ask for. We are expanding testing as per the governor's orders. We are testing and we're tracing and we're isolating, and that's how we're going to beat this thing, because we've got to stay on top of these positive cases. So the governor is exactly on target. If folks didn't get tested and we're still waiting, we'll go back up there.
Let me end with just saying this, that, you know, Secretary Crouch is dead right. The DHHR has done a great job as well, but our National Guard is beyond belief what they've done, and should absolutely be especially, you know, remembered over the 4th of July. But just the job that they're doing is unbelievable. But general, you know, always we got to remember, not confusing effort with accomplishment. We got people in Harrison County that need testing. Now you got to get back there and get back there soon.
We're on it.
I know you are.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and staff. Governor, it occurs to me that one place a mandatory mask order really isn't going to work are bars and restaurants or senior feeding centers, because as soon as the food and drinks are delivered, you got to take the mask off to consume. So are you thinking at all about shutting down or having further restrictions against on bars, restaurants, and also the senior centers?
Mark, we haven't gotten to that level yet. But, you know, from the standpoint of going into a restaurant, if we were to have mandatory masks, and if you were to go into a restaurant or a bar and everything, wear your mask and going in and everything, naturally, if you're going to, you know, eat or have drink or whatever it may be, of course, you've got to take your mask off to be able to do all that and everything. We got all that and everything, but you know, Mark, I guess the easiest way to say anything in regard to this is just this. Everything we have is fluid, meaning that, you know, we've got to be light on our feet and be willing to pivot when we have to pivot. Now, right now, it may very well be that we've got to go to a mandatory masking just going in and out of buildings in hopes that we'll just knock this virus in its tail and do what we've already done before, and that will enable us to not have to back up and do more. But all of us have got to know we got to do what we got to do. And if this thing grabs us in a bad way and everything, we may have to do more. Right now, we don't have to do more. The numbers are great. The numbers are absolutely spectacular. But we know this sea is brewing, and we don't want it to come here. And we can prevent it from coming here if we'll just really be super smart.
All right, thank you, Mark. Governor, I'll turn it back to you.
Well, really, I don't really have anything other than I was going to give Jordan a hard time about Harrison County, and but all I would end up telling you is just this: that you got a real team that's trying to look out after you and doing the very best we possibly can do. West Virginia, you have been the players, though. You know, you can have great coaches, but you got to have players that'll execute. And when it all really boils right down to it, West Virginia, you have absolutely shocked the nation in what you've done. You got to keep doing it. We're going to make the right calls to the very best of our abilities, but then you've got to execute. You've got to absolutely carry the ball. And you've done it and done it and done it. I wish everybody a fantastic, happy 4th of July. I ask you to remember all those 93 West Virginians and all their family, and pray for our nation as well. But absolutely, in every way, I thank you and want you to know just to go out and have a great 4th of July. Be safe, wear your mask, watch what you're doing. God bless each and every one of you.